Welcome to another segment of Wally's nursing videos. Today we will discuss the pathophysiology, interventions, and nursing care for cardiovascular, respiratory, metabolic, and renal disorders. Let's get started. Understanding pathophysiology of cardiovascular diseases. The first objective is to understand the critical pathophysiologic features of several major cardiovascular diseases: hyperlipidemia, hypertension, atherosclerosis, and peripheral arterial disease. Hyperlipidemia is characterized by elevated levels of lipids in the blood, such as cholesterol and triglycerides. Over time, this contributes to forming fatty plaques within arteries, a condition known as atherosclerosis. As these plaques accumulate, they can harden the arteries and reduce blood flow, significantly increasing the risk of heart disease. Hypertension, or high blood pressure, occurs when the force of blood against the artery walls is too high, often due to narrowed or stiffened arteries. Over time, this elevated pressure can damage the arteries and heart, contributing to further complications like heart attacks, strokes, or kidney disease. Atherosclerosis is the progressive buildup of fatty plaques in the arterial walls, leading to stiffening and narrowing of these vessels. It is a major underlying factor in many cardiovascular conditions, including coronary artery disease, peripheral arterial disease, and myocardial infarction, heart attack. Peripheral arterial disease results from atherosclerosis in the arteries supplying the extremities, particularly the legs. This reduces blood flow and can lead to pain, tissue ischemia, and, in severe cases, gangrene or amputation. Pathophysiologic connections. Many cardiovascular diseases are interconnected through similar mechanisms. Let's examine these connections. Hyperlipidemia and atherosclerosis are often precursors to hypertension. Elevated cholesterol levels lead to plaque formation in the arteries, which narrows the vessel lumen. This increased resistance requires the heart to pump harder, raising blood pressure. Hypertension also contributes to further atherosclerosis by damaging the inner lining of the blood vessels. Over time, this damage promotes the buildup of more plaques. Hypertension and atherosclerosis together significantly increase the risk of peripheral arterial disease. With high blood pressure and narrowed arteries, the lower extremities receive reduced blood flow, leading to symptoms like pain, cramping, and poor wound healing. Understanding these connections helps predict cardiovascular disease progression, enabling early intervention and better management. Planning nursing care to slow disease progression. Nurses must plan interventions to slow disease progression in caring for patients with cardiovascular disorders. This often involves lifestyle modifications and pharmacologic therapy. Dietary changes. To lower blood lipid levels and slow the progression of atherosclerosis, encourage a diet low in saturated fats and cholesterol. Diets such as the Mediterranean or DASH diet are recommended for cardiovascular health. Exercise. Regular physical activity helps to reduce blood pressure, improve circulation, and enhance overall heart function. Encourage patients to engage in moderate aerobic exercise for at least 150 minutes weekly. Medication adherence. Nurses are critical in educating patients about the importance of adhering to prescribed medications, including statins to reduce cholesterol, antihypertensives to control blood pressure, and antiplatelet agents like aspirin to prevent blood clots. By focusing on these areas, nurses can help patients reduce their risk of heart attacks, strokes, and other serious complications. Teaching and lifestyle modifications. Patient education is central to managing cardiovascular diseases. Nurses must emphasize fundamental lifestyle changes to patients. Smoking cessation. Smoking accelerates the process of atherosclerosis by damaging the arterial lining, and quitting can significantly reduce cardiovascular risk. Alcohol consumption. Limit alcohol intake to moderate levels, as excessive drinking can raise blood pressure and worsen hyperlipidemia. Diet and exercise. Continued emphasis on a heart-healthy diet and regular physical activity can help control blood pressure, improve lipid profiles, and reduce cardiovascular risk. Educating patients on the importance of these lifestyle changes empowers them to take control of their health and make informed decisions about their care. Impact of medications and therapeutic interventions. Understanding how medications and therapies affect disease progression is critical for nurses. Let's break down key interventions and their pathophysiologic targets. Antilipemic medications, statins. Statins reduce LDL cholesterol levels, thereby slowing the progression of atherosclerosis. They are most effective when combined with dietary changes and exercise. Antihypertensive medications. Diuretics work by reducing blood volume and lowering blood pressure. Beta blockers reduce the heart's workload and lower blood pressure. ACE inhibitors, ACE-I, and angiotensin II receptor blockers, ARBs, prevent blood vessel constriction, helping to lower blood pressure and reduce heart strain. Calcium channel blockers, CCBs, relax blood vessels, improving blood flow and reducing blood pressure. Antiplatelet agents, aspirin, prevent blood clots by reducing platelet aggregation. In patients with atherosclerosis, aspirin reduces the risk of heart attacks and strokes. By distinguishing the roles these medications play, nurses can better support their patients in managing their diseases effectively. Analyzing diagnostic results. The final step in understanding cardiovascular disease involves interpreting diagnostic results that guide treatment and patient care. Essential diagnostic tools include ankle brachial index, ABI. This test compares blood pressure in the ankle and the arm to assess the severity of PAD. A low ABI indicates a significant narrowing of the arteries in the legs. Blood pressure monitoring, BP. Regular BP measurements are critical in managing hypertension and assessing the effectiveness of antihypertensive treatments. Lipid panel. This test measures cholesterol levels, including LDL, HDL, and triglycerides, and helps to guide treatment decisions for hyperlipidemia and atherosclerosis. By analyzing these diagnostic results, nurses can identify disease progression, adjust care plans, and collaborate with physicians to optimize patient outcomes. Cardiovascular emergencies, CAD, MI, CHF, and cardiogenic shock. Let's now focus on more acute cardiovascular conditions, such as coronary artery disease, myocardial infarction, congestive heart failure, and cardiogenic shock. Coronary artery disease, CAD, results from atherosclerosis in the coronary arteries, leading to reduced oxygen supply to the heart muscle, which increases the risk of a heart attack. Myocardial infarction, MI, occurs when a coronary artery is completely blocked, causing part of the heart muscle to die. Symptoms include chest pain, shortness of breath, and fatigue. Congestive heart failure, CHF, can develop after an MI when the heart can no longer pump effectively. Left-sided CHF leads to fluid buildup in the lungs, pulmonary edema, while right-sided CHF leads to fluid accumulation in the body, peripheral edema. Cardiogenic shock is a life-threatening condition where the heart fails to pump enough blood to meet the body's needs, often due to severe heart damage after an MI. Now, we will focus on critical respiratory, metabolic, and renal disorders, understanding their pathophysiology, interconnectedness, and how to manage their progression with nursing care. Pathophysiologic features, respiratory disorders. We'll start by discussing two major respiratory disorders: chronic obstructive pulmonary disease, COPD, which includes emphysema and chronic bronchitis, and how they lead to complications such as cor pulmonale and pneumothorax. Emphysema is characterized by the destruction of alveoli, which reduces the surface area for gas exchange. Patients experience air trapping, difficulty exhaling, and chronic hyperinflation of the lungs. This leads to dyspnea, hypoxemia, and eventually right-sided heart failure, cor pulmonale, due to the increased pressure in the pulmonary arteries. Chronic bronchitis involves chronic bronchial inflammation, which leads to excessive mucus production and a persistent cough. The airflow obstruction leads to hypoxia, hypercapnia, increased CO2, and frequent respiratory infections. Cor pulmonale develops when long-term high blood pressure in the pulmonary arteries from COPD causes the right side of the heart to fail. It manifests as peripheral edema, jugular vein distension, and hepatomegaly. Pneumothorax can occur in patients with COPD due to the rupture of blebs, air pockets, on the lung surface, leading to lung collapse and respiratory distress. Pathophysiologic connections in respiratory disorders. Respiratory disorders like COPD, cor pulmonale, and pneumothorax are closely connected in their pathophysiology. COPD and pneumothorax. In severe COPD, the structural changes in the lungs, such as blebs, increase the risk of spontaneous pneumothorax. When these blebs rupture, air escapes into the pleural space, causing lung collapse. COPD and cor pulmonale. As COPD progresses, chronic hypoxia leads to pulmonary hypertension, which puts strain on the right side of the heart. Over time, this causes right ventricular failure or cor pulmonale. Recognizing these connections is vital for anticipating complications and adjusting the care plan. Nursing care to manage respiratory disorders. To slow the progression of respiratory conditions and improve quality of life, nursing care is focused on oxygen therapy. Supplemental oxygen is administered to maintain adequate oxygen saturation levels, but care must be taken to avoid suppressing respiratory drive in patients with chronic hypercapnia. Ventilator support. Mechanical ventilation may be required in advanced stages of COPD or during an acute pneumothorax. Nurses monitor ventilator settings, ensure proper oxygen delivery, and prevent complications such as ventilator-associated pneumonia, VAP. Breathing techniques. Teaching patients pursed lip and diaphragmatic breathing helps control dyspnea and improve ventilation. Diuretics. In cor pulmonale, diuretics may be used to reduce fluid overload and alleviate symptoms like peripheral edema. Activity and diet. Encouraging physical activity within the patient's tolerance level improves cardiovascular fitness and lung function. A balanced diet supports respiratory muscle function and overall health. Teaching and lifestyle modifications for respiratory health patient education is essential for managing chronic respiratory disorders. Smoking. Cessation. Smoking is the leading cause of COPD, and quitting can slow disease progression significantly. Nurses should offer resources and support for smoking cessation programs. Breathing exercises. Teaching patients incentive spirometry, pursed lip breathing, and effective coughing techniques can help improve lung function and clear secretions. Activity recommendations. Patients with COPD benefit from pulmonary rehabilitation programs that incorporate exercise to improve endurance and decrease breathlessness. These interventions can enhance the patient's ability to manage their condition and reduce the frequency of exacerbations. Medications and interventions for respiratory disorders. Several medications and interventions are used to manage COPD, cor pulmonale, and pneumothorax. Oxygen and ventilation. Nurses ensure the proper use of oxygen delivery devices, nasal cannula, non-rebreather mask, and mechanical ventilators when needed. They monitor for signs of oxygen toxicity and ensure patient safety. Bronchodilators, e.g. albuterol. These medications relax the smooth muscles in the airways, improving airflow and relieving shortness of breath. Diuretics. Used in cor pulmonale to reduce fluid overload, helping to relieve symptoms of right-sided heart failure. Chest tubes. In cases of pneumothorax, a chest tube may be inserted to remove air from the pleural space. Nurses must monitor for complications such as infection, ensure proper drainage, and prevent tube dislodgement. Analyzing diagnostic results for respiratory conditions. Key diagnostic results to monitor include arterial blood gases, ABGs. ABG analysis is essential for determining oxygenation, ventilation, and acid-base balance. Nurses interpret pH, PaO2, PaCO2, HCO3, and oxygen saturation levels to guide treatment. Pulmonary function tests, PFTs. These measure lung capacity, volume, and flow rates, helping to assess the severity of COPD and monitor disease progression. By analyzing these results, nurses can adjust care plans and interventions to optimize respiratory function. Metabolic and renal disorders, diabetes, mellitus, and acute kidney injury. Next, we'll focus on metabolic disorders like type 2 diabetes mellitus, DM, and its complications and acute kidney injury, AKI, which can be closely connected with diabetes. Pathophysiologic features, type 2 diabetes, mellitus and complications. Type 2 diabetes mellitus, DM, is characterized by insulin resistance and decreased insulin production, which leads to hyperglycemia. Chronic hyperglycemia can cause both microvascular and macrovascular complications. Acute complications. These include diabetic ketoacidosis, DKA, and hyperosmolar hyperglycemic nonketotic syndrome, HHNS, both of which result from severely elevated blood glucose levels and dehydration. DKA is more common in type 1 DM, while HHNS occurs in type 2 DM. Chronic complications. These are divided into microvascular, e.g. chronic kidney disease, CKD, and macrovascular, e.g. cardiovascular diseases like stroke and myocardial infarction. Pathophysiologic connections between diabetes and other disorders. Type 2 DM is closely linked to several other conditions through shared pathophysiologic mechanisms. Atherosclerosis and hypertension are common in patients with diabetes, as chronic hyperglycemia damages blood vessels, increasing the risk of cardiovascular disease, stroke, and peripheral arterial disease, PAD. Diabetes and chronic kidney disease, CKD. Prolonged hyperglycemia damages the kidney's filtering units, glomeruli, leading to diabetic nephropathy and eventually CKD. Understanding these connections helps nurses anticipate complications and intervene early to prevent further organ damage. Nursing care to manage diabetes and prevent complications. Nursing care for diabetes focuses on preventing acute and chronic complications. Blood glucose monitoring. Regular blood sugar checks help keep glucose levels within target ranges. Nurses must educate patients on the importance of self-monitoring and using insulin or oral hypoglycemic agents as prescribed. Dietary management. Educating patients about carbohydrate counting, portion control, and a balanced diet can help manage blood sugar levels. Nurses often work with dietitians to develop individualized meal plans. Medication adherence. It is crucial to maintain glycemic control and that patients understand the use of insulin or oral medications, such as metformin or sulfonylureas. Teaching and lifestyle modifications for diabetes. Nurses play a crucial role in teaching patients with diabetes about lifestyle modifications. Sick day rules. Patients must learn to adjust their insulin or oral hypoglycemics during illness to prevent dangerous hyperglycemia or hypoglycemia. Exercise. Regular physical activity helps improve insulin sensitivity and lowers blood sugar levels. Foot care. Due to the risk of diabetic neuropathy, patients must inspect their feet daily for injuries and avoid tight shoes to prevent ulcers and infections. Medications and interventions for diabetes and renal disorders. Several therapeutic interventions can help manage diabetes and prevent complications. Insulin, used to control blood sugar levels in patients who cannot manage with oral medications. Sliding scale insulin may adjust doses based on blood sugar readings. Oral anti-diabetic medications. Biguanides, metformin, reduces glucose production in the liver and improves insulin sensitivity. Sulfonylureas stimulate the pancreas to release more insulin. GLP-1 agonists increase insulin release in response to meals and slow gastric emptying. Phosphate binders and EPO, used in patients with CKD to manage complications like hyperphosphatemia and anemia. Analyzing diagnostic results for metabolic and renal disorders. Key diagnostic results include blood glucose levels. Monitoring fasting and postprandial glucose levels helps assess glycemic control. Kidney function tests, GFR. Glomerular filtration rate, GFR, is used to assess the severity of CKD. Urine microalbumin detects early kidney damage in diabetic patients. By interpreting these results, nurses can adjust care plans to slow disease progression and manage complications effectively. Conclusion. This lecture examined the pathophysiology, connections, and nursing care for respiratory, metabolic, and renal disorders. Nurses play a pivotal role in assessing and managing these conditions by educating patients, administering appropriate treatments, and monitoring vital diagnostic results to improve outcomes. Whether dealing with COPD, diabetes, or acute kidney injury, comprehensive nursing interventions can help slow disease progression and improve patient quality of life.